Hi, I'm Dr. Sharbell Hashoul, and today I want to tackle a question I hear all the time. Do underwire bras cause breast cancer? Let's clear this up once and for all. This myth has been around for decades, and it usually goes something like this. Underwire bras squeeze the lymphatic system in the breast, block the drainage of toxins, and those trapped toxins build up and turn into cancer. It sounds logical on the surface, which is probably why it has stuck around for so long. But when researchers actually studied it, the theory didn't hold up. Here's the background. The idea seems to have taken off after a book published in the 1990s claimed a strong link between bra wearing and breast cancer risk. But that book was not based on a proper scientific study. It didn't account for other factors that affect breast cancer risk, like age, family history, weight, or whether someone has had children. Since then, actual scientific studies have looked at this question directly, comparing large groups of women who wore underwire bras with those who didn't, and looking at how often, how long, and how tightly they wore them. The consistent finding across this research is that there is no link between wearing a bra, underwire, or otherwise, and breast cancer risk. It's also worth understanding a little bit about how the lymphatic system actually works, because that's the heart of this myth. The lymphatic system is a network of tiny vessels that helps drain fluid and waste from tissues throughout your body, including the breast. It's true that lymph nodes near the breast, especially under the arm, play a role in breast cancer because cancer cells can sometimes travel through lymphatic vessels to nearby lymph nodes, but that process is about how existing cancer can spread, not about how cancer starts. There's no evidence that pressure from a bra strap or underwire meaningfully blocks lymphatic flow, and even if it did, blocked lymph drainage doesn't cause the DNA changes in cells that actually lead to cancer developing in the first place. Breast cancer starts when there are changes or mutations in the DNA of breast cells that cause them to grow and divide abnormally. The things that influence this are factors like age, genetics, hormone exposure over a lifetime, certain lifestyle factors, and family history. Wearing a supportive undergarment simply isn't part of that picture, and major health organizations, including the American Cancer Society, have reviewed the evidence and confirmed there's no connection. So why does this myth persist? Part of it is that bras, especially underwire ones, can sometimes cause temporary discomfort, itching, or even a visible mark on the skin if they don't fit well. That physical sensation can make it feel like something harmful is happening underneath, even though discomfort from a poorly fitted bra is completely different from a biological cause of cancer. If an underwire bra is uncomfortable, that's a good reason to look for a better fit or a different style, but it's not a health warning sign related to cancer risk. Here's the practical takeaway. Choose your bras based on comfort and support, not fear. If wearing an underwire bra works for you and feels good, there's no scientific reason to avoid it because of cancer concerns. What actually matters for breast health is staying up to date with the screening recommended for your age and risk level, knowing what's normal for your own body so you can notice changes, and talking to your doctor if you ever feel a new lump, unusual pain, skin changes, or nipple changes. Those are the things worth paying attention to, not the style of your bra. I hope this helps put one common worry to rest so you can focus your attention on the things that truly do matter for your breast health. As always, if you have questions about your own body or any symptoms you're noticing, please talk with your own doctor who knows your history and can guide you properly. Thanks for watching, and I'll see you in the next video.